right, you're wondering what we're doing here. Well, this is a good example of how physical therapists are literally experts on using household items for very good exercises to create good posture, less pain, etc. So here we have Mike is our patient. We have a table here, kitchen table. We'll show you some excellent exercises to be done very easily. Anything, Mike?
All you need for these are a kitchen table, like we mentioned, a towel would be handy, and possibly a ball.
There you go. What are you eating?
Well, nothing on this dirty plate.
All right, let's get on with the program. All right, before we go on, it was a Green Bay Packer plate. Mike is a Viking fan. That's why he is disgusted. I'm Brad.
I'm Mike, and behind the scenes we have Bob, and together we're the most famous physical therapy team on the internet.
In our opinion, of course. And subscribe, please.
If you are new to our channel and like this video.
All right, so here we have a table. It's a typical height of a table, nice chair. So what we're going to do is work on things that are going to make you more functional. If you have problems reaching up into a cupboard because you have tight shoulders, if you have pain in the shoulder or in the neck or even headaches, this can be a good exercise. Anything else, Mike?
I thought that's a 30-second timer. It's 30 minutes. No wonder it moves so slow. Anyway, we're going to get on with it. So the first one we're going to do is address your shoulder. So if you're having some shoulder, neck pain, discomfort, oftentimes what can be the culprit is actually your shoulder blade itself or your scapula. So in order to do this, you need a tabletop. If your hands do not slide nice on it, which mine are kind of sticky right now, so don't slide the greatest, take a towel and place it over top here. You can do palms down, or you can kind of do a neutral thumbs up. Choose what feels best for you. And what happens is as I start to lean forward, this is actually bringing my shoulder overhead like this. So I'm allowing the pressure and muscles to relax. The pressure of the table and the shoulder muscles to relax as I go forward. So oftentimes the people have limitations lifting their shoulder above head without pain. I can't talk today.
Yeah, let me talk. Go ahead, Mike. So he's going, the shoulder blade, scapula, is actually rotating, sliding across the thoracic or the rib cage, giving it mobility that it needs. And that's very important because sometimes the scapula can actually get stuck or depressed. This exercise will help release it. Very important. And the other really good thing about it, if you got a messy table, you'll wash the table as well. The other thing we do want to talk about is this is going to help with the muscles right up in here, which the levator scapula is that tight muscle that can cause some headaches and neck pain. It's going to help loosen that up as well.
Now, if you only have one painful side, you can just do this with one arm. You don't have to do it with both. And you can kind of mess around with the angles a little bit and see what feels good for you.
Yep, there you go. A little motion is really good. Now, the next thing we want to talk about is now we're going to actually not use a table so much, but we do have the towel here. So fold it up, and we're going to work some neck pain specifically and some shoulder pain around the neck like Mike has it. Lower on the neck is usually better, but with some support. And then, Mike, can you show him this stretch?
So what we're going to do is pull down towards the floor with the towel, not super hard, and then I'm going to work on extending or looking up towards the ceiling, working on neck extension, and you can just gently go back like this. You can hold it for 5-10 seconds and do repetitions, do 10 repetitions of this. You can also try to mess around with moving the towel around different locations depending upon where your pain might be, or you can even bring the towel up with you and cradle it a little more if that feels more comfortable.
I do want to put out a little warning. It's possible there may be occasional time where some people, when they do this, get lightheaded or dizzy. If you feel any of those symptoms, you simply stop. It is not an exercise for you. And if that's the case, you may want to see the doctor and find out if there's any unusual reason for that. Mike, let's talk about posture. Now, this is a really aggressive but comfortable posture with the ball. Mike has invented this about 10 years ago.
This is a baby ball.
You could
probably use a larger one, but anyway, if you could take a ball or something small, you can even possibly roll up a towel. There we go. I want this one. And what you're going to do to work on your posture, if you're working at a desk or at your kitchen table, you're probably sitting there like this. So you're not in very good posture. So what we want to do is go the other way into extension. So place the ball behind your back. You can go mid-back. You can go a little higher up. Find the spot you need it. And then we're going to work on just extending our spine backwards like this. And it just feels good to stretch. And you can add a little bit of arm movement in there as well. Even some W's. Brad's making fun of my shirt because I got some pit stains on it. But we're going to stretch anyway.
Well, I do want to mention you don't have to use a ball behind your back because that is pretty aggressive. As long as your chair is at about this height, if it goes up to your head, one of those tall back chairs, this doesn't work so well. A lowered, firm back chair will work, and you'll find a nice stretch with that as well.
Did we hit 30 minutes yet? No, the timer's still running.
The timer's still going. We got to keep talking. All right, so we got another video for what are we talking about here? Oh,
posture, breathing, and neck pain.
For 55 years and older. Yeah, it's a nice video. We'll go into some other options to do this type of treatment to yourself.
Boy, this is a great video. We're just rambling away today.
Well, we got to wait till it stops. We're almost done, Mike.
Keep watching till the end.
All right. Really, they're good, actually good exercises. You can do it right at the kitchen table.
Bob and Brad, the two most famous physical therapists.